asked me why did I study medicine. In Afrikaans we have a nice terminology. If you have a vocation, that's a beroep. If you have a calling, it's a roeping. Now, the studying and practice of medicine for me was this roeping, a calling, not a beroep, not just a vocation. After school, I had the wonderful opportunity first to go study science, that is physics and chemistry, the basics of all science. Okay, a bit of mathematics behind too. But while there, I bought a farm. And very soon after graduating, I went farming. Unfortunately, on the farm, me and the tractor and wagon had a bit of a disagreement, and they won the game. So I ended up in hospital, staring around me and seeing these doctors in the white coats walking around there and talking languages that I didn't quite understand, which made me a little bit uneasy. Why can a graduate of science not understand scientific terminology? So that plus the calling thing called me going to medical school, which was very helpful to know what I was going to do with that knowledge before I started gathering it. Helped me to gather from all the medical knowledge the parts that is applicable to what we want to do here. I think one of the reasons why I had trouble with medicine, particularly the first few years, is I thought it was an exact science like physics and mathematics, but it isn't. You know, there's a lot of art in there, and one has to adapt to gather the art part that is more humanity. Shortly before my accident on the farm, practitioner of so-called alternative health rented the estate from the family to put up a thing they called a hydro. First time I heard of that word in medical senses. This was a chiropractor, homeopath type of facility, but they apparently failed financially. So one day we arrived to see how things are going, and there was a few patients or guests and no staff, and we were kind of forced to take over. That fitted so beautifully in with this calling, you know, to go study medicine, and seeing how these things can be applied in a bit of a different way from the orthodox allopathic medicine, but not with losing the science behind it. Question was I married at the time? Yes, indeed. I married the most beautiful girl on this planet in 1975. We formalized this marriage in 76, but this same girl gave me the most beautiful kids, and she actually worked my way through medical school. Everything I needed, everything to sustain ourselves. And she taught me the lesson of life. That is now the philosophy of life for me. And that is the greatest blessing that you can have, is the ability to count your blessings. Well, even during my studies, I often helped out at Hoogland in medical, paramedical situations, learned quite a lot from other practitioners here. And then as soon as I left medical school, practice was waiting, and I walked into something I actually already knew, except now it was formal, registered, qualified, and I could prescribe medicine, do procedures, etc., as might be necessary in these circumstances. Very soon after starting, I established a laboratory at Hoogland that tested a variety of biochemical parameters, later on hematological parameters, etc. The reason for that was, there was just improvements in health, just changes in people's well-being that couldn't be explained by what was taught at medical school. It just didn't quite fit. There was something more to it. And to understand that, we had to get to below the surface, and the laboratory helped me do that. For some years, I employed actually a professor of mine from the university that taught us pathology to help me set up this thing and start knowing how to do quality control, how to run instruments, how to understand chemistry, later on hematology with that. And when this professor of mine went to a different practice, I employed one of his ex-students, who was a practicing pathologist at the time also. And when I really understood quite well this relatively limited scope of investigations that I do here, I could continue on my own. Best explanation is to say it's a facility or an institution that lies functionally halfway between a hospital and home. Spa is similar. Both our words hydro and spa refers to water, but the spa is much more focused on immediate enjoyment, and the hydro is more focused on long-term, real, innate health. So where are we now? Well, after practically 40 years in practice, we still have to try and explain some symptoms that we don't fully understand. And why do people get better? Because we know why they get better. We can refine what makes them better, get rid of the excess baggage of what is used in the practice to get people better, and just refine to what really works. So the challenge of modern healthcare, the way I see it, is the challenge is to find the disease before the disease finds the patient. It's easy to diagnose when the symptoms are there and when the pathology shouts at you, but to know what's going to happen in the next few years if we don't intervene right now, and to know how to intervene. That took years. Well, we've had 40 years so far. Now, what are we aiming at? In orthodox medicine, we typically say if you're not sick, you're healthy, which is of course totally wrong, because the absence of disease is not the presence of health. It's like the absence of bankruptcy is not the presence of wealth. Material wealth don't make you happy. What makes you happy is seeing other people becoming happy, other people becoming healthier, and that's what we have here.